From the Toronto Star, I'm Saba Eitizaz, and this matters. It's time to get our masks on. Toronto's City Council has voted today to make masks mandatory in all indoor public spaces. The bylaw is meant to make masks compulsory in businesses like grocery stores, but will not apply to children under 2 or those who can't wear masks for medical reasons. The reason is simple and has been tested in other countries. Masks will protect others from COVID-19, who can in turn protect us from the same. Even US President Trump, who's been shunning masks at his rallies, might have had a change of heart.
I'm all for masks. I think masks are good. I would wear, if I were in a group of people and I was close, people have seen me wearing one. If I were in a tight situation, I'd have no problem. Actually, I had a mask on. I sort of liked the way I looked.
But while public health officials and politicians might be pleading for people to mask up, some people are having strong feelings.
You cannot make people wear a mask. It's not our laws at all. This is just made up by Bill Gates and them.
I'm frustrated that I don't feel good physically. Like, I can tell you right now, I wasn't getting enough oxygen, and I just had on one of these little stupid things. I feel dizzy. Look at the numbers and tell me why everybody's living in fear. Tell me why we're putting these things on and not being able to breathe. I just want to cry. I'm not okay with it.
And if you think masks are only contentious and political in the US and are having a meanwhile in Canada moment, think again. Here's a confrontation at a Toronto hospital this week.
I'm not allowed to video, but you're making me wear a mask. Otherwise, you're going to deny me service if I don't wear a mask. I'm at St. Joseph's Hospital. They're telling me that if I don't wear a mask, they're not going to assist me. They want me to leave.
Anti-mask Facebook groups like Mothers Against Distancing or MAD have popped up linking individual freedoms to cloth masks.
Those of us who are more awake and more in the know as to what's been going on have been calling us Karens.
Basically, a Karen was reserved for somebody who was trying to force their beliefs onto somebody else. We're not doing that. We're just trying to give people the actual facts.
But in many parts of the world, wearing a mask at a time of illness is already the norm, and the stakes are higher now than ever. So why are masks provoking such a strong reaction? Today, I talked to Toronto's Associate Medical Officer of Health, Dr. Vinita Dubey, to unmask the situation. We talk all things mask, what we need to do to protect ourselves and others, and why are we still talking about this in the first place? Thank you so much, Dr. Dubey, for joining us on this podcast today.
My pleasure. Thanks for having me.
So, first of all, a pertinent question here, because apparently there's a lot of skeptical people still out there. What exactly does wearing a mask do? Can you break it down for us?
Sure. So we actually talk about non-medical masks, or really cloth masks or face coverings, as being useful for source control. So what this means is that your germs stay to yourself. When you wear a mask that covers your nose or your mouth, if you cough, if you sneeze, if you talk, and you're wearing the mask will act as a barrier to catch those germs so that they can't spread to others.
Right. And as you mentioned, this is a cloth mask, which is sort of used for the functions of source control. There's 2 different functions and kinds of masks, aren't there? Those that can actually protect the wearer from getting infected, and those that can protect others from getting infected. So what are we mostly referring to here? Which kind of mask?
So we're referring to the latter. You wear a mask mostly to protect others from your germs. So what we say is, I wear a mask to protect you, you wear a mask to protect me. The 2-way type mask, where you wear a mask to protect others and also to protect yourself, are classically medical masks. And the reason why we're not using medical masks in this situation is because medical masks are under short supply. We've seen that there were concerns about them early on in the pandemic of being able to have enough for frontline workers. And so we want medical masks to stay in those settings. And this is why we're talking about the use of a cloth mask or face covering.
So it operates on this societal message of I protect you, you protect me. Why is this important? Can you talk a little bit about the evidence and the theories coming out that a mandatory mask policy will actually work and help control a second wave of COVID potentially?
This virus, it's still a new virus, even though it feels like we've all been in it forever. But, this virus was just introduced kind of internationally the end of December. We had our first case January 25th. I mean, this is all quite new. And we've gone through what we call phase 1 of the pandemic, or the wave 1, where we saw lockdowns lockdown restrictions. We saw a number of cases occur in our city, in our province, and the cases now are decreasing, but we certainly have never had a day where we've had 0 cases reported. And so we still know that COVID-19 is spreading. It's still circulating in our city. We know people are still catching this virus every day. And so we need to be able to do more because we want to be able to open up the economy again, to loosen public health restrictions. But if we're going to go back out into society, open things up, the risk again increases for spreading this virus. And so a mask can act as a public health measure that we can all take to help prevent the spread of the virus in these situations.
And we've seen it in other countries, haven't we, where a mask policy has worked or has been effective in fighting this.
That's right. So the studies have shown, they're what we call ecological studies. So they're looking at populations, cities where mask policies have been introduced, and they've seen a slowing of the spread of COVID in those places. So that's some of the scientific evidence that we have for the use of masks. For sure.
And we're talking now about certain government provisions. What exactly does it take to make masks mandatory? How do you see that strategy working out? How will this be enforced, do you think?
So the mask bylaw that we have in place in Toronto asks that businesses, operators of establishments, that they have a policy in place for mask usage in their establishment. And so they're required to have a policy on masks. They're required to post signage on the mask bylaw, and they're required to train their staff on the policy. And if a business does not have a policy or cannot show a policy to an enforcement officer, the business can be charged.
Right. And is most of the enforcement going to be around that kind of monitoring or policing? Because there are obviously concerns that there are not enough bylaw officers or police to actually monitor this in that way. Do you feel that that would be the range of it? If you're not complying to the mask policy, you might be fined? Or do you feel there's going to be more of an enforcement around education and social awareness?
There's no question that our intent is actually for education and to actually increase mask use. One of the things that we know is that when you make a mask law, when you require masks in public settings, then mask usage, people use masks more. And, the more people use masks, one modeling study suggested that if 80% of people were using masks, it would have a much bigger impact than, say, if only 50% of people used masks. And so that's definitely part of it. And so the enforcement will be on a complaint basis. And it will be, again, going to the business, asking the business for the policy and educating them on why it's important for the business to have a policy on mask usage. The one thing that's worth noting, though, is that a customer in a store is not going to be fined. Each business has to decide in their policy how they will deal with a customer who comes to the door and doesn't have a mask.
So something around a policy maybe that the business would have to come up with regarding no mask, no service, correct?
Yeah, but if someone doesn't have a mask, either they turn the customer away, maybe they educate the customer that time, maybe they provide the customer a mask, maybe they sell the customer a mask. They also, though, have to be aware that there are exemptions that are allowed as part of the bylaw. And so it can't be a strict no mask, no service, because if you have an exemption, and the exemptions are, for example, being under 2 years of age, having any medical condition where it would be difficult for you to wear a mask, needing accommodation under the Ontario Human Rights Code, well, then you have to be able to allow those people entry, and you cannot ask for proof from them for their exemption.
So if this is now going to become the case for the foreseeable future, isn't there any discussion about being able to provide people with masks because there are concerns of access or affordability for, let's say, the underprivileged or low-income communities? Has there been any talk of how to tackle that?
Absolutely. And that's a really important point. We talked about it, actually, it's called the mask or face covering bylaw. And one of the reasons why face covering is still in there is because everyone has a scarf or a piece of cloth or an old t-shirt that they can convert into a mask or wrap around their face to act as a face covering. We also know that the TTC is handing out masks to some of these groups. And we're working with some of our organizations to be able to, again, facilitate masks for people who may not necessarily have them, because that's a really important consideration. Health equity is definitely something that we're concerned about.
Right. The incorporation of masks into our lives, both from a science and a public health angle, these are questions and points that we're addressing and wrestling with for the first time. So for people from a public responsibility perspective, what should be the rules of mask wearing as have been decided up till now?
So it's a really good point. We're not used to wearing masks. I mean, I work in an emergency department, so I've been trained on how to properly wear a mask. But for those of us who have never been in that environment because of work, we actually have to learn how to wear a mask properly. And what we know actually is that if we don't wear a mask properly, we can actually increase contamination. And so that's definitely something we want to learn. So what it means is that you have to wash your hands before you put the mask on. The reason for that is if your hands are dirty, you don't want to contaminate the mask. If you have a cloth mask, we suggest having 2 colors or 2 different patterns so you know which side of the mask face outwards and which one faces inwards, because you want to keep those 2 separate. Then you put the mask on. The mask should cover your nose, your mouth, and your chin, and it shouldn't be gaping. And usually it's loops behind your ears or you tie it up. And when you put the mask on, it should feel comfortable, because what we don't want you doing is fiddling with your mask. The more you touch your mask, the more your hands can get contaminated. So after you've put your mask on, then you wash your hands and you carry on. And you try not to touch your mask. You try not to touch your face.
And I also want to talk a little bit about some of the split or the polarity around this issue. Why is it that we are still having debates on mask wearing here when it's become so common in other parts of the world, especially in countries that have shown now a strong capacity to fight back against COVID? What do you think this says about our messaging and strategy around masks so far? Do you think we've been successfully able to push the sort of small sacrifice for the greater good community perspective messaging on this?
Well, I think that's something that let's wait and see in Toronto. But I've certainly seen related to COVID that our city has stepped up, that people have made sacrifices, people have put others first. We've all been in it together to help fight COVID. And so I think wearing a mask just is one added measure to do that. The science is not 100% there, but it's getting there and it's convincing enough to allow us to go ahead. And so I think it's twofold that way. I know that people want to be able to protect others and they want to protect themselves, but they also want to be able to start living life normally or going back to some form of normalcy. And I think the mask is one way that can help us to do that. We have to be careful, though, that the mask doesn't give us a false sense of security, that if I wear a mask, I can now not have to keep my 6 feet distance, or I don't need to worry about washing my hands. That's not the case. I mean, another reason to promote masks is masks may actually act as a visual cue. If we see people wearing masks, we'll remember, actually, COVID is still here. We're not out of the woods. We have to keep up with those measures in everything that we do.
It's interesting you should talk about that and about there's definitely a lot of people that have stepped up in this challenging time. But I was talking to my co-host Adrian about this the other day, and we were talking about seeing so many people in Toronto who seem to have given up on wearing masks. And a lot of people that I know personally are quite frustrated. Like, why is it so hard to convince people to care about the people that they're around? So how do you do that? How do you build that kind of messaging to convince people about this basic consideration for everybody around them and then in turn being protected themselves?
Yeah, I mean, what we know in public health is that behavior changes can be quite difficult, right? It's quite difficult to get people to eat properly all the time or to exercise every day. You know, some of those measures can be quite difficult to adopt and to make part of your own. So the fact that it will take time is okay, because we know that behavior changes can take a while before you actually adopt them. But we can all help each other to help each other realize that this is a good thing to do. If we see others wearing it, we'll feel more comfortable wearing it as well. But we also have to recognize the risk. And the risk in indoor settings is actually higher. And so we need to take more precautions in those settings. And so if we have a difficult time wearing a mask, for example, well, then maybe we need to change our behaviors so that we spend more time outdoors. We keep that 6 feet distance at all times. Maybe we spend more time at home until we're more comfortable wearing the mask. But I think these are the types of questions and decisions that we need to start making. We need to be more flexible and recognize, you know what, I'm not comfortable wearing a mask indoors, so maybe I won't go to that shopping mall today because of that. And these are our new realities because of COVID.
There's countries where mask wearing has sort of become a part of the social fabric, like in China and in a lot of countries in Asia. Masks are seen as a courtesy that you do for the fellow people around you in order to not necessarily protect you, but to protect the person next to you. So as you already mentioned, other than the government directives, do you think there's a massive cultural and behavioral shift that needs to happen? How do we get there, do you think?
Well, we know that post-SARS, which was many, many years ago, mask usage in some of these Asian countries increased because of SARS. And so it's not that it's, they've worn masks forever and ever and ever in some of these countries. They adopted the behavior because of something that happened. And so I think the same thing could happen in our society as well because of COVID-19, because we recognize the importance of it, because we wear it not just for ourselves, but for others. And we actually even see with this virus that this virus actually is more severe in vulnerable people. We want to look after our elderly. We want to look after those who may have other illnesses so that they don't catch it. And that's part of what can become part of our societal psyche in terms of wearing masks going forward.
So I know in Canada, unlike in the US, it's not the same situation where masks have become somewhat contentious and political, but we're still seeing a lot of Facebook groups, splinter groups emerging, viral videos talking about mask wearing as a form of maybe virtual signaling or sort of like a barricade to civil liberties. What do you think of this splinter movement? Are we seeing the anti-maskers as a new anti-vaxxers movement, perhaps?
I think there's no question that misinformation, especially as it spreads on social media, is having very devastating effects on science in general and on some of our behaviors. I mean, we see that with vaccines. With vaccines, the science is very clear. They work, they're safe, and yet we still see a loud, though small, group of people who are against vaccines. And a lot of that is spread and perpetuated through social media and through misinformation. And so I think what we need to take out of anti-mask sentiments is where's the information coming from? And just with all information that we get from the internet or from social media, we need to be able to understand what's the source of it. Is there truth to it? Sometimes it's related to half truths or it's pulling on some sort of an emotional response that may not even be related to the actual science that it's talking about. And so I think these groups make us have to reflect, where are we getting our information and what information are we going to trust?
And what are you seeing in terms of this mask policy? We do have these directives for now. How long do you see this as a practice that will need to be implemented? How long are we going to be wearing these masks for? And if it's a long-term thing, how do we need to approach that?
You know what? It's a really good point. From a public health ethics perspective, if we put in a public health measure that is restrictive for people, it should not be forever. It should be time limited. And so same with this bylaw. The bylaw is actually for 3 months and it will be revisited at the September council meeting. But every month, the medical officer of health has to be able to assess the mask bylaw and decide whether it still needs to continue. Because if we're in a situation where COVID is no longer a risk, we don't need to wear a mask, well, then we need to be able to pull the bylaw back. So it's certainly not a forever piece. Right now, it's in place for the next 3 months. And then we need to be able to assess it on a monthly basis.
And towards the end, would you like to give some advice or tips to people? What is the best kind of mask that they can use? Or if they do not have access to one, what other alternatives can they use in the meantime to protect others around them and themselves?
Well, the best mask is one that's comfortable for you, because what you don't want to be doing is to fiddling with a mask. So you want one that fits you properly, that you can wash easily. You can just throw it in your laundry and wash it that way. You probably need more than one mask because you might need to change it through the day, especially in the summer. If a mask gets soiled or wet, you need to be able to change it. So you might want to have one paper bag or a plastic bag that has clean mask, one with a soiled one so that you don't mix them up. For those who don't have access to a mask, there are actually really simple, no sewing ways to actually take a piece of cloth, an old t-shirt, and to just make some cuts and be able to make a mask for yourself. Again, you could use a scarf and wrap it, or even a bandana, as long as it's not gaping, can serve this purpose as well.
That's so helpful. Thank you so much, Dr. Vinita Dubey. It was an absolute pleasure having you on the podcast.
It's absolutely my pleasure. And thanks to everyone who is doing their part by wearing a mask. You know, I wear it for you, you wear it for me just as well. And so we're all in this together. So thanks a lot.
That was Dr. Vinita Dubey, Toronto's Associate Medical Officer of Health, answering some of our burning mask questions. That's it for today. Thanks so much for listening. This Matters is hosted and produced by me, Saba Eitizaz, Adrian Chung, and Raju Murter. Produced and mixed by Sean Pattenden, and our director of programming is JP Fozo. Our show theme music is by So Called, and our episode music is by Mike DeAngelis. We want to hear what stories matter to you. Please send us comments, questions, or ideas to thismatters@thestar.ca. Please consider supporting the journalism the Toronto Star newsroom does at thestar.com. And don't forget to subscribe to This Matters on Apple Podcasts, Spotify, or wherever you listen to your favorite podcasts. Let's talk soon.